Good afternoon, everyone. I'm Dr. Gaurav Deshmukh, Manager Global Medical Affairs, Derma Cluster, Glenmark Pharmaceuticals. And on behalf of Glenmark, I welcome you all to this Facebook Live session on different aspects of atopic dermatitis. Today, we have with us eminent speaker, Dr. Hardik Dave. Now, Dr. Hardik Dave is a consultant dermatologist practicing in Mumbai. He has completed his MD in dermatology. He has excellent diagnostic skills, and he is skilled in variety of cosmetic procedures such as mesotherapy, Botox, dermal fillers, laser therapy, and chemical peelings. He is adept in various dermatosurgery procedures like excision of liposomes, sebaceous cysts, vitiligo surgery, cryosurgery, etc. He is a member of IITVL, has one publication to his name in international journal, and he has multiple awards to his name like IITVL GSK National Dermatology Quiz second rank. Then he also received National Talent Search Scholarship in 2003. He has received Maharashtra Talent Search Scholarship for both the standards 8 and standard 9 with all India ranking of 7th and 17th respectively, and he is a recipient of state scholarship as well. So with this, I welcome Dr. Hardik Dave to this meeting. Welcome, sir. Uh, and I would like to request all the delegates over here. So if they have any question, they can write their question in the comment box, and then we can take up those questions during panel discussion. So with this, I now request Dr. Hardik Dave to start with his presentation. Sir, over to you.
Okay, thank you, Dr. Gaurav, for the introduction, and thank you, Glenmark and all its team for providing this platform to share my knowledge about this disease, atopic dermatitis. Okay, so I will start now. I'll try to keep it short and not to bore all of you. So atopic dermatitis is a common type of eczema. It is sometimes interchangeably used, but there are different types of eczema, and atopic dermatitis is one of the most common types of the eczema. And it is a slow, continuous type of disease with remissions and exacerbations, and that makes the life of the patient quite a harass to live on a day-to-day basis. Okay, so the atopic dermatitis usually begins in the first 6 months of the life, or it can start in the childhood also. It is characterized by mainly itching. The itchy and dry skin is the characteristic of atopic dermatitis. It is basically an immune dysfunction type of disease in which the body skin is very much reactive, and a lot of triggers cause it to become very dry, itchy, scaly, and scratchy. So the child is very uncomfortable. He or she scratches it a lot, and that causes a lot of damage to the skin, and which can sometimes lead to a secondary infection by bacteria or viruses. So it is a common condition seen in about 10 to 20% of the children, but over a period of time, generally the child outgrows it, and by teenage time, most of the people of the atopic dermatitis get rid of this condition on its own. But it has to be treated and kept under control. Nowadays, because of all the pollutants in our surrounding, many a times the atopic dermatitis does not go away in adulthood, and it continues. At times, it may also start in adulthood and then continue for the rest of the life. Okay. There is association of atopic dermatitis with other allergic conditions like asthma, hay fever, allergic rhinitis, and other things. People with atopic dermatitis can have food allergy, depression also. So what is the cause of this? So exact cause is not known, but mutations of proteins called filaggrin are suspected, and that causes the structure of the skin to be a little bit different. So they do not have enough ceramides and other lipids which moisturize the skin. So the skin is dry, itchy, and very much sensitive to the surrounding triggers. And this leads to a lot of exacerbations and remissions. So some Sometimes the people will have a totally completely normal skin, and sometimes it will become very bad with lot of rashes, oozing, scratching, inabilities to sleep because of those itching. So it shows up in childhood. It starts with the scalp and face, and slowly over a period of time, when the child starts crawling, it can happen on the elbows and knees and those areas which come in contact with the surface. As the child grows up, the area of affection of the atopic dermatitis changes. It then starts coming on the inner thighs, in front of the elbow, in front, and behind the knees, those areas, and neck, face, hands. Adult onset generally happens more on the these areas, and it harasses quite a lot, so that the normal day-to-day life is not possible. So how do you treat it? Okay, so treatment is basically lifestyle modification. Lifestyle modification involves making sure the products which you use are allergen free. So specific atopic dermatitis products are available, but mostly paraben free, allergen free is written on all those products, and those are quite safe for these people. And another main thing is to keep the thing in remission. There is no cure. We cannot cure atopic dermatitis, but there is good amount of treatment available. But the patients have a big role to play in it in a day-to-day life. So what they have to do, the children and the parents both have to take care. Moisturization is the key. It's like a diabetic person has to keep on taking the medicines to keep the sugar under control. The atopic dermatitis people have to keep on moisturizing the skin to keep the atopic dermatitis away. That will make sure that the remission is for a longer time, and they do not get a lot of exacerbations. So during bath, mild soaps. After that, immediate moisturization if needed, again in the evening on full body. And whenever there is an increase in the atopic dermatitis, they have to consult a proper dermatologist, a skin specialist, not a general practitioner, and get it sorted out. Because home remedies are also a lot of the times they cause the trigger of atopic dermatitis. In fact, instead of improving it, they cause it to become much worse. So that has to be taken care of, and a regular treatment and understanding the needs of the children by the parents is quite a important thing, because they will be the main provider of the care to the children, and that will help in keeping it under control. So that is my take on the atopic dermatitis. I'll just explain a little bit about the symptoms which you get. There is the child or the patient generally has a lot of itching. They will keep on scratching, and the skin, when you touch it, it feels very rough and dry. Then over a period of time, it becomes scaly, red, angry looking. It will start weeping, and sometimes over a period of time, it will envelop the complete full area of the body, and then you have to take care and do a good long treatment of it to make it under control. So if you take proper care of atopic dermatitis, you can live in a very healthy and very symptom-free manner. But that is the main thing. Treatments are there to keep it under control. We just have to consult a proper dermatologist, a skin specialist, not a GP, not a pediatrician, for this care. So, Dr. Gaurav, that should conclude all of what I want to say. And you can, I think you have some questions for me from the
Okay, sir.
audience.
Thank you very much, sir, for such an excellent presentation on atopic dermatitis, explaining all the symptoms, the triggering factors, and the treatment in brief. So, sir, we have few questions with us. I would like to uh,
Okay.
you to answer those questions. So, first question, sir, we have is, sir, how common is atopic dermatitis in clinical practice? So,
It is quite common, say about 10% of the population children will have atopic dermatitis of some severity. And in children, I see in every month you get at least 10-15 new cases of atopic dermatitis, and adult people say hardly one or two.
So, according to you, sir, atopic dermatitis is more common in pediatric age group compared to adult age group.
Yes.
Yes, thank you, sir. So, sir, then the next question is one of the delegate who is watching. He wants to know what are the common symptom should he look for in his child. So to guess it as the atopic dermatitis and to seek the dermatologist advice.
Okay, so if it is a very small child, just a newborn, for 6 months or so, the symptoms are a little different. In those patients, in those children, there is a lot of rash on the scalp, on the face, and on the chest area. And the child is always cranky. He or she will be keep on crying and scratching the area, and there will be a lot of scaling and the white scales, the skin falls off, there will be a angry looking skin. So that is in the small child. And when the child starts crawling at that age, it on the extensor surface, on the behind of your knees and elbows, those areas, they will start getting rash. It will be dry and it will be a lot of scratching. So child keeps on scratching it, and many a times they do not want to have a bath. They do not want to anybody to touch that area, because at times there is a secondary infection to it, and if they basically find the skin to be very dry and itchy, they have to consult the skin specialist to get it sorted.
Thank you, sir. Then, sir, one more question we have from one of the audience. So, sir, does patient with atopic dermatitis also have some other non-dermatological symptoms?
Yes, atopic dermatitis is basically an allergic condition where the immune system is dysfunction. So similar conditions of other systems are also involved. So allergic rhinitis, people sneeze a lot. They get a lot of allergies from the airborne thing. Other thing is asthma. There might be a history of asthma in parents, and the child itself might develop asthma in future. And otherwise other things like thyroid dysfunction might be there, and there might be an ichthyosis, a genetically skin dry condition.
Apart from symptoms of atopic dermatitis, uh, parents or patient who is taking care of patient should also look for these symptoms. Thank you, sir. So we have one more question. So, sir, what are the common skin areas where atopic dermatitis is commonly seen?
So the first area generally which is visible in the child thing I've already told, in adults and in a little bigger children, and they are in the elbows, the inner side of the elbow, and same with the knees. So just behind the knees where the joint is formed. So those areas are the areas where it starts. And another area commonly is the hands, the fingers which are exposed to the triggers. So in these areas, this starts, and sometimes if it is airborne dermatitis, you get it on the face. So these are the areas where it starts, and then over a period of time, if it is neglected, it spreads to other areas.
Thank you, sir. So, sir, we have one more question. What are the common triggering factors? So, in during your clinical practice, what are the common triggering factors you have experienced from patients for development of atopic dermatitis or relapse of atopic dermatitis?
Yeah, so one is weather, cold and dry condition causes it to trigger. Other thing is whatever is touching to the skin. So it can be soaps, the harsh soaps, especially people are now trying Ayurvedic soaps which have antiseptic properties, that triggers atopic dermatitis. So you have to use a mild non-allergic type of soap. Other thing is clothes. So the clothes have to be cotton, pure cotton, and in winters the inner layer should be cotton and outer layer should be wool. And then exposure to dust and oils and all other things. So when the child plays, you cannot tell them not to play, but try to avoid with the areas where they have a lot of dust in it. And once the child comes back, have a bath and immediately apply a lot of moisturizer, so the triggering will be less. And over a period, food is generally not much of a factor, but it is lot of times stressed by the patients and the parents ki you mat khao, but mostly food is not that big a factor. It is whatever is touching the skin. So uh, the Indian people have a habit of applying a tika or having those threads tied to the wrist or on the waist, and those things have to be avoided. Whatever friction is there, that has to be avoided, and non-cotton things have to be avoided to be touched to the skin. And also they try to wear something in the ears, which if it's artificial can at times trigger the atopic dermatitis.
Thank you, sir. Thank you explaining all the triggering factors, especially regarding the soaps. I reinforce that point. Whenever patient with atopic dermatitis should use mild soaps. So, sir, next question from the audience is how common adult atopic dermatitis in your practice, and is the presentation of adult atopic dermatitis is different from pediatric atopic dermatitis, or the symptoms are similar, or the severity
Since
is more?
Okay, adult atopic dermatitis generally the frequency is quite less compared to the children. It is other types of eczemas are more common, but the symptoms are similar to what we see in adult, a little bit bigger child. But the thing is, once it's triggered in adulthood, it generally stays for a longer time, doesn't go away on its own, and has to be taken care of a lot. And the triggers are generally whatever are workplace associated. And many people are working in chemical factories, or they have a field work, so they have to travel a lot, so they are a lot of time in sun and dust, and they sweat a lot, and they have to keep on wearing the same clothes. These things trigger, and many a times you cannot tell them to change it is not possible to change the field of their work, and so they have to live with it, and they have to suffer a little bit. So they have to apply moisturizer and take the treatments quite frequently. And once it comes under control, if it is moisturized well, it generally gets better.
Thank you, sir. Sir, coming to the last question for today's discussion. So, sir, what are the various treatment modalities? So, sir, during your presentation, you explained a few of the treatment modalities, but what are the common treatment modalities you prescribe in your patients with atopic dermatitis?
Okay, so first and foremost, the treatment modality which I use is counseling. Patient and the patient's caregiver has to be counseled properly, because lifestyle modification and taking care of it will help in making sure that the patient is in remission for a very long time and can live a healthy, stressful life. Second thing is to make, so that includes prescribing them soaps and body washes which do not trigger atopic dermatitis. Second thing is telling them good moisturizer. Now a lot of moisturizers have come which are specific for atopic dermatitis. They have ceramides and all other lipids which are deficient in atopic dermatitis people. But these are more expensive, but even a normal white soft paraffin like moisturizer is good for mild cases. You have to apply it full, like you have to eat food daily, you have to apply moisturizer daily, twice in a day at least, for full body. That is the main thing. These are the basic things. Second, after that, if it is not controlled with this, topical treatments with mild steroids and calcineurin inhibitors is the first choice. If it is very severe, there are a lot of options. Oral steroids, azathioprine, cyclosporin, methotrexate. These are the tablets which can be tablets and oral medication which can be prescribed. Even immunobiologicals have come out now, which helps in suppressing even the most severe cases. So treatments are there. Even if it's a severe case, there are some. We have to do some basic blood tests to keep it under check, and the treatments will take care of it in say a month or two. The child will become much better and will live happily.
Thank you, sir. Thank you for explaining all the aspects regarding atopic dermatitis beautifully, and covering all the queries of the audience thoroughly. So, with this, I would like to thank you, sir, for this wonderful session.